If you have upper back pain, you're gonna wanna watch this. So your upper back is made up of 12 thoracic vertebrae. So cervical is your neck, thoracic is the middle part of your back, lumbar is your low back, and then we have your sacrum. Now, with your thoracic spine, these little things that point out, these are your spinous processes. When you bend over and you see the little bit of bone, that is your spinous process. Off to the side, this is your transverse process, and this is where your ribs also attach. The way the motion works in the thoracic spine is when you bend forward, these little joints here, called facets, they're planar joints. When you bend forward, they open. When you come back, they close. And when you backward bend, they fulcrum. Now, these little facet joints also do a small bit of gapping with rotation. But the thing is, in our everyday lives, we're kind of stuck in this forward bent flexion. If you're a woman and you have breasts, welcome. Your upper back will be stiff. Starting from about T4 down, I've never seen women not be stiff around that area because we wear bras, we have breasts, we're holding children. There's all these things that have a little bit more stress for women than men. Now, we can fix the stiffness in our thoracic spine, but we have to be intentional with it. What we would do would be mobility exercises. So I'm always talking about strengthening for women, but we have to pair strengthening with mobility. It is wonderful to get strength, but I also, as you strengthen your back muscles, need you to maintain that mobility. So when you're doing exercises in yoga, such as a child's pose, this is coming forward and it's opening. When you do upward dog, this is coming back and it's fulcruming. This kind of motion going between flexion and extension helps to loosen up and mobilize. If you are afraid of exercise and don't know where to start, look up sun salutations. It is what I always tell my patients to start with as a beginner, easy 10 minutes yoga sequence. That is one example of a thoracic mobility routine. Another example of a thoracic mobility routine would be something called CARs, which is controlled articular rotations. And thoracic CARs look like yoga, except they're being very intentional with you going segment by segment. So segment by segment and gaining motion. So ladies, if you've been lifting and working on your strength, congratulations, I am super proud of you, but I now need you to also do probably 10 minutes of mobility a day. The other thing is, your pecs, which are the chest muscles in the front, are very, very tight because you have breasts. So then your breasts pull you forward, and this makes your pecs go, and then your thoracic spine goes, and then you get kyphosis. So I would really love for you to have a mobile, healthy, pain-free thoracic spine. Now, the other thing I didn't mention is your thoracic spine also does rotation. And how do we fix that rotation? Well, if you're already doing child's pose and you're sliding your arms forward, would it be too hard or too much to ask is if you add your arm under and kind of thread that needle and get a little bit of rotation, a little bit of rotation. If you work on rotation consistently, if you work on your thoracic mobility consistently, you will see your back pain start to melt away. It's real. Also, this is good for headaches. Bye.